such an amazing group of people. Today we have the development sector here, we have the private sector here, we have the World Bank here, we have representatives from the government here. It's a very, very interesting group here.
I think can bring in a change to the way that we work and the way the nurses are being treated in this country. Bringing nurse practitioner programs to Bangladesh would automatically elevate the status of nurses.
This is really a shift that is required in the country, and I applaud this initiative for actually putting this on the agenda.
To try to understand what would be the needs and how can we support.
The simulation learning, you would need to follow best practices that have been established by organizations such as the Society of Simulation Healthcare and Education to ensure solid outcomes.
What strategies do you recommend for ensuring sustainable investment in nursing education and training in Bangladesh?
So we need to have take a deeper look into how private sectors can be involved so that we can use their entrepreneurial acumen.
I have a feeling that nurses are very much sincere and they may be as good, as professionally as good like the US nurses.
Invite more bankers here to become the sponsor of this. Then we have more fund and we can develop more training and invite also a trainer from abroad to improve our quality of the nursing here in Bangladesh.
We are committed that we will work closely for the betterment of the nursing and midwifery sector and also for the better health of this country. Not only this country but also, as we have a growing demand for nurses and midwives outside the country.
Again, I want to focus on the work for the social, challenging the social norms.
If you look back in the last 15 years, there are a lot of specialized hospitals and we need specialized nurses. So we are trying to give specialization training for making specialized nurses.
So that's the question, I'm leaving it for you. So I think before we start to talk about elevating the nursing profession in Bangladesh, we should take the responsibility from the educators as a commitment that we should bring the joy in learning for the students.
If you can create some posts like patient care attendant or something, ancillary services who can support the nurses or patient, then nurses can give the better care to our patient. This is the number one.
And we are getting the support, editorial support from the 3 different countries like Thailand, Korea and as well as England.
Whether I can work independently, I can provide service to the clients they need, definitely in terms of quality, in terms of the other aspects.
Mentorship programs can be incredibly powerful. Mentoring nurse faculty with experienced nurse faculty, both here and abroad, can be really powerful for ongoing continuing education.
Of Bangladesh Nursing and Midwifery Council, we are working. We want to make a standard curriculum.
They are so much busy with the administrative and other things. So this is the reality we have.
So if we are talking about elevating the nursing services as a whole, I think we also need to talk about what is the working condition like.
And still, there are opportunities for us to continue to grow the profession and elevate the profession and provide more opportunities for nurses.